Hi guys, welcome to Dr. Ram's Medical Coding Academy. This session we are going to talk about medical billers. Medical billers are nowadays seeking so much of coding education. So many people have this confusion what this medical billing is all about. Well, we will have a separate session where we will discuss about this medical billing thoroughly. But the need of the hour is many medical billers are seeking this coding education or the so-called entry-level training. So let's talk about that. So this video would be very helpful for medical billers who are working in these healthcare companies or RCM companies or medical billing companies. Okay, the first thing is like when a medical biller is going to come for a coding education, it's going to be tremendously hectic for them because they might have night shifts. So when we talk about medical billers, two kind of people come into play. So one kind of people actually work in the day shift, it's like the Indian day shift, and the other people work in the Indian night shift. What happens is, so medical billing roughly we can classify into various types like charge entry or payment posting or eligibility verification or this analyst team. Whereas at night we would have this AR callers, which is the accounts receivable department, and patient callers. So here what happens is we really need to understand which type of medical biller is going to take this education in training. Because what happens is when an AR caller is going to come for this coding training, it's going to be terribly difficult for them because they'll have to work the entire night shift and then they'll have to sit for the classes which takes place during the daytime. So you need to figure out, you really have to balance your job as well as the training. Okay, so next thing is like, what happens when a medical biller is going to opt for a training? It's like, so now will they have to, look out for a medical coding job as a fresher, or can they be moved in their own companies? So my suggestion would be, first of all, please understand, you are already on the other side of this revenue cycle management. Okay, when this knowledge of coding is complete, you complete this RCM cycle. So if you have ample experience with medical billing, so my advice would not be just lose that valuable experience. Because nowadays there are so many companies that are hiring for an RCM specialist or a person who has good experience in medical billing and medical coding as well. So I would just let you know to take the training so that this would be a feather in your cap. You don't have to lose your valuable experience. So if you are a medical biller or a payment poster or a charge entry guy or an AR person, so you take up this coding education and see in what way this medical coding training can add value to your profession. Because what happens is once you know this knowledge of coding, so this box, the unknown world, which is a medical record, is known to you. So what you can do is like, now here you complete the RCM cycle and you become an RCM specialist. So two things that you can do. If you think that you really want to quit your profession and go for medical coding, in that case, you will be considered only as a fresher in coding and your experience will be lost. So if you're already working as a medical biller and if you have this coding education and see if you can make use of this coding training and appear for this internal job postings within your company. So normally what happens, bigger companies, they're always in need of these coders. So when these medical billers take up this coding training, internally they can appear for various training or this interview that is being conducted by the coding department or the coding managers, and thereby they can be easily absorbed into the coding department. Now the advantage of doing like this is, now the salary package, this would continue from that place onwards. So it's like if an air caller is getting like 20 or 25,000 and he's being moved to this coding department, from there he will have his hike. Whereas if you are going to look out for this coding job elsewhere, your billing knowledge will not be considered and you are considered a fresher and your usual salary starts from that package. So that's certainly going to affect your financial status. So my humble suggestion would always be, look out if there is an opportunity for improvement in your own company itself. If you have an opportunity where you can attend these internal job postings and you can appear for this interviews and written tests conducted by the coding department, and see if you can be easily placed in your own company itself, so that you now become a coder. From then on, your salary is also increased, and then you are now in the dominion of this coding department. Okay, now the question here is, what if the company where you are working does not have this opportunity? So here again, it is you who will have to make this decision, because going to know this medical coding, it's an added advantage. Now you know how to deal with these medical records. Tomorrow, if a claim comes to you, you are working in a denials team as an analyst, and you are reviewing a particular claim where there is a coding related issue. So if you are the right person, you can just review it and you can do a claim resolution. Definitely your company is going to value your job. So in that case, this would be certainly beneficial to you. So it is left to you whether you want to quit this department of medical billing and join as medical coder as a fresher, or you want to get promoted in your own arena itself, adding this coding training as a feather in your cap. At Dr. Ram's Academy, we have trained hundreds of medical billers. I have had these AR managers as our students, payment posters, analysts, and AR callers as our students, and many of them have got this training from us. So I would like to just narrate one experience of mine where a medical biller who was actually a QC guy in this AR department actually took up this training from us. He just underwent this advanced medical coding training, and later on he just was appearing for the CPC examination. But then he did not appear for this examination, but he was just undergoing the training. He just requested a certificate that he's undergoing training, and you will not believe this certainly made a difference in his career, because when there was a job posting internally, his added knowledge on coding helped him to acquire and bag this medical billing manager's role from the level of an AR QC. Okay, so this shows a difference where coding can add. And tomorrow, if you are attending a client's call and you have your doctor as your client, and if you can resolve any of his issues, because commonly when I worked in my medical billing companies, what happened was that suddenly the AR team would call me, hey Dr. Ram, please come and attend this call, because I never understood what this doctor was saying. He was talking about one particular procedure which I totally was aware of. So at such times, what you can do is, if you are a person who knows this coding to some extent, certainly your doctor will never want to leave you. And moreover, your company also certainly values your role, because you are able to interact with your client in the most comfortable manner, because here you are now learning this language of medicine. See, again, many people want to take up this CPC examination. I tell you, finish up your advanced level training, because no matter how many years you work with this medical billing industry, medical coding is related towards this clinical side of this medicine. So it is always going to be hectic and difficult to comprehend. And the landscape of medicine is constantly changing, and every year the coding books, the coding guidelines change. So it is very difficult for an AR personnel or for a medical biller to understand all of these changes just by undergoing the CPC training. So it is always expedient that you undergo this entry-level training first, and then you appear for the CPC. Again, many billers think that CPC is the only option that is available to them. Unfortunately, that's not the case. There is yet another certification which is called as CPB, which is called as a Certified Professional Biller. Just as CPC, which is a Certified Professional Coder, we also have a Certified Professional Biller. Here, what happens is this medical biller, once he clears this exam, he is now a certified medical biller. Again, if I want to talk about that examination, this is going to be a 5 or 40 minutes examination just like the CPC, and it has the same value as that of a CPC. And you will not believe, there are not many people who have completed this examination. In fact, when I completed this exam, only then I realized how difficult it was and what was the level of knowledge that a medical coder is supposed to have. Okay, so you will be having 200 questions, and you will have to select you will have to clear 70%. In that, you will find definitely 15 to 20 questions of coding, and definitely I never thought that it would be so difficult, because The questions were so brand new, and it was like so, very difficult questions, which was even challenging for a medical coder. So that is a level which a CPB can give to a medical biller. So once you acquire these or you clear this CPB, you become a certified professional biller. Or if you want to come to CPC, again you become a certified professional coder. And when these medical billers have started to acquire these certifications, definitely it makes a difference in your career, because your clients really value the credentials and the certifications that you possess. And it will be really enchanting, when you're attending client calls, your clients would certainly respect you because of this credential that you have. So finally, I just want to conclude, like medical billers, yes, there's time for improvement, because coding is always subject to change. If you're not going to change in this profession, things are getting automated, and so you really need to fasten yourself and learn this medical coding so that you become an RSM specialist. So if you have any questions, you can always reach out to us. We are also conducting training exclusively for medical billers in the Sunday batches. So where we have a team of medical billers from reputed companies who are attending the classes from 9 to 12 every weekend. So this would go for like 4 to 5 months, and once you complete this training, we will be provided with this advanced coding certificate, and this would certainly make a difference in your career. So please contact us for Dr. Ram's Academy. If you have any queries, if any medical billers, whatever process you are in, you can always reach out to us, and we are always there to help you. Thank you.
You can contact us at 805 60 855 96 99 62 79 1072.